Hello guys. So today we shall be discussing regarding the thyroid gland. Okay, so we shall discuss the complete anatomy of thyroid gland, specifically talking the clinical anatomy of your thyroid gland, and we shall discuss every aspect related to that. And when it comes to the clinical points, will mainly focus on those points which are repeatedly asked in your exams, right? But anyways, I shall be anyhow covering all the clinical points which you need to know regarding the thyroid. Now, when it comes to thyroid, learn this topic very nicely, because when it comes to surgery, definitely there will be few questions that will be repeated in almost all exams regarding this thyroid. Okay, so the first important thing, let us start here. You just tell me what will be the weight of thyroid. All of you know thyroid is butterfly shaped, right? So tell me what will be the weight of the thyroid gland. So let me write down over here. Yeah, so if you look, the weight of the thyroid gland is somewhere around 25 grams. Okay, it is around 25 grams. And all of you should know these basic points, guys. Before we move on, just know these basic points. The thyroid is considered as the largest endocrine gland. Okay, thyroid is considered as the largest endocrine gland. And where is this thyroid actually present? If you see, this is your thyroid cartilage, right? So just beneath this, you have got your tracheal rings over here, right? So anterolateral, this is anterior and this is lateral. It means thyroid gland is like this actually. You can see the anterior aspect, you can see the lateral aspect also. So this is the exact location of thyroid gland. It is anterolateral. Anterolateral to what? Anterolateral to trachea. Okay, as you can see in this picture clearly, right? You see thyroid gland is present anteriorly and laterally as well. To what? To this center part called as trachea. Okay, so let me write down this point over here. So what was I telling you? I was telling you that thyroid gland is present anterolateral to trachea. It is present anterolateral to the trachea, right? If we talk about the topography, if we talk about the topography of this entire gland, so from where does this gland start and where does it end, what are the vertebral levels, etc., everything we shall discuss right now. Okay, so first important thing is that this gland all the way doesn't start from the midline. Obviously, this gland starts from the oblique line of thyroid cartilage. Just look at to this particular picture over here. You can see this is your thyroid cartilage from the lateral side. From the lateral aspect, you have got this green color line. You see, this green color line is called as a oblique line of your thyroid cartilage. Okay, let me write it down. Let me write it down. We shall go step by step. Okay, so this is your oblique line of your thyroid cartilage. This is your oblique line of your thyroid cartilage. So all the way from the oblique line of your thyroid cartilage, this comes down. See guys, don't confuse with the picture here. You think that it is present in the front, then why are you drawing it laterally? No, see, it is not present exactly in the front. You see these lobes over here, right and left lobe. The right and left lobe, they go laterally and it attaches to this. What is this? This is your oblique line. Okay, it goes laterally and attaches to the oblique line. So let us say this is your trachea. Okay, this is the thyroid cartilage. Let us say you see this line over here and you see this line over here. These are oblique lines. So the gland starts from here and goes forward. Here also it starts from here and goes forward. Okay, so it starts all the way from the oblique line of your thyroid cartilage down till which tracheal ring? To fifth or sixth tracheal ring. If we can figure out over here, you see here there is an oblique line over here. Let us say it starts from the oblique line and all the way down till which tracheal ring over here, guys? That is the fifth or the sixth tracheal ring. Okay, so it starts from the oblique line till the fifth or the sixth tracheal ring. Okay, so this is the basic outline which you need to know. Very, very, very important. Okay, once again I'm telling you the topography. It starts from the oblique line of your thyroid cartilage all the way down till the fifth or sixth tracheal ring, right? So trachea, thyroid cartilage, all of them are present anteriorly, but what is present posteriorly here? Vertebra. So in perspective with, in relation with the vertebra, at which level, at which vertebral level is this thyroid gland present? So thyroid gland, if you look at the vertebral levels over here, thyroid gland starts at the level of C5, you see, C5 and all the way till T1. So when it comes to the vertebral level, it starts all the way from C5 till T1. Okay, when it comes to the topography of the thyroid gland, vertebral level of thyroid gland, vertebral level of your thyroid gland over here. Okay, so it is said that basically, guys, you just remember like this center part is a trachea. Okay, in front of the trachea there is thyroid gland. Actually thyroid gland is hugging the trachea from the front. Okay, just imagine that there is a pole over here and you are hugging the pole from the front. Okay, so that is how the thyroid gland is exactly situated over here. Okay, so this is, so far what did I discuss? I told you only the topography. Okay, so you have to remember oblique line till fifth to sixth tracheal ring. When it comes to vertebral levels, it is from C5 all the way till the T1. Okay, now let us discuss about what are the lobes of thyroid gland do we have. What are the parts of the thyroid gland? What are the parts or lobes of the thyroid gland we have over here? So just look into this particular picture, put it down, right? Look into this picture. All of you know, first let me show it and then I'll write it. This is your right lobe of your thyroid gland. This is your left lobe of your thyroid gland. Okay, connecting your right and left lobe of your thyroid gland, you have got this particular part. This is called as a isthmus. Okay, what is this called? This is called as your isthmus. So we have got, one is the right lobe of your thyroid gland, left lobe of your thyroid gland, and we have also got another important thing that is called as a isthmus. So far how many lobes we have seen? The first important thing is we have seen the right lobe, second is we have seen the left lobe, and third important thing is we have seen the isthmus. Three important things. Apart from that, can you see there is a small lobe-like structure that is emerging above from the isthmus, right? So there is a small lobe or there is a small extension from this isthmus. This is your isthmus. From the isthmus, there is a small extension that is going upward. This is looking like a pyramid. So I am calling this as a pyramidal lobe. I am calling this as a pyramidal lobe. Okay, so again I am writing here, what is pyramidal lobe? It is an upward extension of your isthmus. Okay, this is your upward extension of your isthmus. Upward extension of your isthmus is called as your pyramidal lobe. Now there is no wrong in this picture, guys, and it is actually true here. The thing is, you might think this picture is might be a bit cross. It is not cross actually. See, if this is the midline, where is the pyramidal lobe present? Pyramidal lobe is present towards the left side, I mean away from the midline towards the left side. Okay, there is no wrong in this picture, right? Apart from that, another important thing I'm seeing here, what is this? What is this is that, you see, this pyramidal lobe is connected all the way to, what is this bone over here? This is your hyoid bone. Okay, so this pyramidal lobe is connected all the way to the hyoid bone with the help of, you see, a band like structure, a fibromuscular band here, right? So this fibromuscular band is nothing but called as levator glandulae thyroidae. Okay, what is this? Levator glandulae thyroidae. So let me write it down over here. This part over here is your levator glandulae thyroidae. So what is this? This is actually a fibromuscular band. Fibromuscular band. And I'm not writing here one thing, that is, this is the band that is connecting your pyramidal lobe all the way till the hyoid bone. So this is the basic thing which you have to remember. Now next question which comes into your mind is, what is this fibromuscular band? What is this? What is the use of this? Actually there is no use of this, but you have to remember, if you have studied the development of thyroid gland, the embryology and all, right? So in that particular part, uh, there are videos of embryology where I've discussed all these things. You can go watch that. So there, this particular duct previously was called as a thyroglossal duct. Okay, and this is the remaining part of the thyroglossal duct. So remaining part of the thyroglossal duct is what that is called as your remnant. Okay, so what is this actually? Levator glandule thyroidae. This particular levator glandule thyroidae, there is no space, and just making a turn over here. This is your remnant. This is your remnant of your thyroglossal duct. Remnant of your thyroglossal duct. Okay, this is your remnant of your thyroglossal duct. Okay, so till here I hope is everyone clear with this, guys. So we discussed the topography, right? We discussed the topography in relation with the tracheal rings, topography in relation with your vertebral level C5 to T1, and now we have also discussed what are the different lobes we have got. Now, surrounding the thyroid gland, you have got capsules. Okay, you remember that when I was discussing the prostate gland also, surrounding the prostate gland, we have discussed capsules. Like there is something called true capsule, there is something called false capsule, right? So the same things are present in the thyroid gland also. We have got true capsule, we have got false capsule. Let us look at that. Now further, what I'll do is that I'll cut the thyroid gland and I'll put a camera on the top and just look into that. So this is how it looks, right? So this is the thyroid gland in the center, right? Now this is the thyroid gland in the center, and let us look at the capsules which it has. First of all, let me write down some theory over here so that you understand it. Basically, this particular thyroid gland is having two different types of capsules. Okay, so one is called as your true capsule, another one is called as your false capsule. Okay, so what you have got? You have got true capsule, another one is called as your false capsule. So first let us locate where is this true capsule and where is this false capsule over here. Okay, so you can see that this particular thing over here, let me zoom it up. See, you see this green color outline over here, this is called as your false capsule. This is called as your false capsule. And next, the innermost one is called as your true capsule. So this is your true capsule. So I can say that true capsule is very thin in comparison with the false capsule. Okay, you see, usually true capsule is thin over here, false capsule is bit thick. Okay, why it is thick I will tell you later on, but just now understand that true capsule is thin and it is very closely adherent to the gland. See, all this yellow color thing is your gland. Now you tell me, true capsule is closely adherent to the gland, isn't it? Right? But beneath the true capsule, just beneath the true capsule, we have got another important thing. What is this? You know what is this? This is called as your venous plexus. Okay, so all the veins, what are all this? These are not the anatomical instruments, guys. These are your thyroid veins. Okay, see, these are your superior thyroid veins, middle thyroid veins, inferior thyroid veins. We have got three pairs of thyroid veins. I will discuss the thyroid veins also today. Okay, so just I'm telling you, I'll just write it as thyroid veins. Okay, don't go into details. No, thyroid veins. Later we'll discuss the thyroid veins in detail. So these three thyroid veins are there. Now all these three thyroid veins together, they join and form a plexus, and that plexus is called venous plexus. So why are you stressing it here? Why am I stressing it here is that just keep this thing in mind. Okay, I will talk about this point later on, so just listen to whatever I'm telling right now. Usually in the thyroid gland, we have got false capsule outside, true capsule inside, venous plexus inside, much more inside, right? Inner to true capsule. This is the structure that is present within your thyroid gland. But when it comes to your prostate gland has got different thing. False capsule